Hello everyone, welcome back to my channel, Lady Like Me. This is Sherry. For today's video, I am going to share with you my first pap smear experience, and also I will share with you some tips to make this appointment or test more comfortable. So if you're interested, then please keep on watching. February 20th, I had an appointment with my OBGYN for my first ultrasound. On this appointment, I also talked to a nurse, and I think I was 9 weeks pregnant. And she told me that I should get my pap smear test. I don't have any records in the military system, that's why she really required me to go through this test. I am almost 30 years old, but I haven't done this test yet. I have been with my partner for a long time, but even if that's the case, I know I still have to do this test. Pap smear test is a screening procedure for cervical cancer. Back in the Philippines, our culture there when it comes to this matter is really different. Pregnant women don't go through pap smear tests. Usually this kind of testing is done before pregnancy or after pregnancy. So when my nurse at Balboa Hospital told me that I have to get this test done, I freaked out and I was caught off guard. I found out that here in the US, you can get a smear test as early as at the age of 21, and also for pregnancy, pap smear test is a part of your prenatal care. If the result is abnormal, then there are some procedures that can be done that's also safe for the baby. But it depends though, it depends on your diagnosis. More often than not, delayed treatments after the baby is born is the way to go. I am someone that strongly believes that the connection of a physician and a patient plays a fundamental role when it comes to effective care delivery. And for someone like me who's terrified of seeing a doctor, I need to find someone that I can connect with, that I'm comfortable with. Since I wasn't really feeling the staffs at Balboa Hospital, I chose to do the pap smear test at Miramar Clinic. March 13th, I believe I was 12 weeks pregnant. I went to Miramar Clinic to do my pap smear test. When I came to the clinic, a very friendly Filipina talked to me and prepared me for my appointment that day. She checked my weight, she checked my blood pressure, and she was wondering why I was palpitating so much. And I told her that I was nervous about my smear test. I also told her about my concerns. What if it hurts the baby, or what if it's so painful? So in return, she comforted me and told me that I was in good hands. 5 minutes later, after seeing my nurse, I met my midwife. Her name is Kathy. I think she's in her late 40s, early 50s. By the way, my husband was with me during this appointment. When I met with my midwife, I thought she will bring me right away to the room to do the test, but that was not the case. My husband and I went to her office and she read to me all of my test results. She confirmed that I was negative for HIV, STD, what else? And also my cystic fibrosis screening came out negative, so I was happy. Since this is my first pregnancy, she informed me a lot about how to handle it. And also I talk about some of the issues that are bothering me, like my acid reflux. So in return, she gave me a medicine for it and gave me a few advices to make this pregnancy more comfortable for me. That interaction was so valuable for me because the more I talked to Kathy, the more I was comfortable with her. She is gentle, calm, informative, and compassionate. She also knew that I was so nervous with my pap smear test, so she said that I don't have to do it right now. We can just do it after the baby is born. I was going back and forth to the idea of getting it done that day or not. I have to put a pillow in here because my back hurts. Anyway, my midwife Kathy didn't really demand it. that I should get the test done that day. So this is what I am. If I wasn't forced to do something, I'm gonna do it. But if you force me to do it, then I'm not gonna do it. My nurse at Balboa Hospital told me that I should get that test. I was like, I know I can say no to her. I know that I can just take the test after pregnancy. But when this really compassionate midwife of mine told me that it's okay, we can just do this after you deliver the baby, then I was thinking maybe I should get one right now while I'm with the right person. My husband and I was left in her office while she was actually preparing some of my documents. And then I remember my nurse came in. She took us on a different room. She was preparing me for my ultrasound. I didn't know that I will do ultrasound on this visit. She was preparing the room. She was preparing the first started to look like a chair and then it just expands. You can just lie there. I don't know. But she was preparing it for me. My nurse and I talk about smear test. She told me that Kathy, my midwife, is so gentle, and also she showed me the tools that they're going to use for my smear test. All of it. I'm gonna insert a picture on this video because I was just taking pictures while I was in this room. I was just entertaining myself. I was nervous, but not really. So she showed me the speculum. The speculum that they used is the plastic one. And since it is my first time to do the smear test, they will use the small speculum, small plastic speculum. I also saw the cervix brush, the cyto brush. The cyto brush looks like a spoolie with a long handle. After seeing those tools, I decided I really have to go through this test. I emptied my bladder. They gave me good amount of time to prepare, to get undressed, and to wear that hospital gown. I lie down on this examination table and I put my feet at the stirrups. My midwife was there facing my, veg. My nurse was on my left side, and then on my right side was my husband. He was sitting down and he was just trying to entertain himself with the phone. I don't know what he's doing. I was more comfortable knowing that the only person looking at my vag is my midwife, because my nurse is right here. Like, you're covered up from this part to here, and then you kind of like put your as I've explained, I had my feet up on this stirrups, like wide open. Kathy did pelvic exam slash physical examination before she did the smear test. For the procedure of the smear test, as far as I remember, Kathy gently inserted the lubricated plastic speculum on me. When she opened the speculum, because she had to expand this thing, so this is your vag, right? And then the speculum goes in. The midwife or your physician, whatever, have to open it or expand the speculum at a certain level to see the inside. That part was the climax for me. It was not painful, but it is uncomfortable. I had to concentrate on my breathing and to not really push the speculum out. After that, they will like do a scraping. I didn't really feel the cervix brush, or what's the other tool that I saw? It's a cyto brush. I'm not quite sure what she used, but I didn't feel a thing. After she collected the cell sample, she removed the speculum with ease. It didn't hurt, and it was done. I was super amazed that it wasn't as bad compared to what I imagined it would be. From the insertion of the speculum to the removal, it only took less than a minute. Kathy was super gentle and super quick. I love her. After my smear test, we saw the baby. We saw him super active, kicking and moving around. We also heard his heartbeat. And yeah, I totally forgot about the smear test that I just took. Later that day, I felt cramping and also a little bit of discomfort, especially during urination. But I didn't have any bleeding at all. The next day, the cramping is gone. I'm back to normal.